Hi friends, now let us learn the arteries and nerves in the anterior compartment of forearm. As you have already learned the muscles which are present in anterior compartment of forearm. Now you will easily understand the nerves and arteries which you can see in the anterior compartment of forearm. Let's come to the arteries first. Okay. Let me draw. You can I guess what I'm drawing. Just think about the forearm. This is forearm. This is wrist, and here this is the hand. I'm not a perfect artist, so just this is the hand. Okay. Now let us see the. Where is the red pen? Yeah. Now, this is the brachial artery. As you know, brachial artery at the neck of radius, it divides into two arteries. One is ulnar artery and the other is radial artery. So this is the ulnar artery. So first let us learn about the ulnar artery. Ulnar artery, it is the terminal branch of the brachial artery. Where does it arise? It arises in the cubital fossa, just at the neck of the radius. Okay, and then what does it do? It runs downwards, obliquely mainly, up to the middle of the forearm, and then after that its course is mostly straight. Okay, and then it enters the palm deep to the flexor, in front of the flexor retinaculum. It enters the palm in front of the flexor retinaculum, and then it combines with the superficial branch of radial artery to form superficial palmar arch. Okay, and in all the through all its course, along all its course, it is accompanied by one nerve. You can guess this nerve very easily. It's nothing but the ulnar nerve. See, this is the ulnar nerve. This is ulnar artery. And next, in dissection, where can you find this ulnar artery? It's easy to find it in dissection. It's simple. First, you have to reflect the flexor digitorum superficialis, pronator teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris. What are all these? You have to reflect all the superficial muscles. All these five are the superficial muscles. Once you reflect all these superficial muscles, you will be finding flexor digitorum profundus. Okay, between superficially there will be all these 5 muscles, and deeply there will be this muscle. What is this muscle called? Flexor digitorum profundus. In between them, this ulnar artery will be there, and you can easily find out by it lies medial to flexor carpi ulnaris. That is, if it is flexor carpi ulnaris, it just lies medial to flexor carpi ulnaris. That is the position of this ulnar nerve. So you can find out the relations very easily. If you come to the relations, anteriorly all superficial muscles. You know the superficial muscles? Flexor carpi ulnaris, flexor digitorum superficialis, flexor carpi radialis, palmaris longus, and one which I missed is pronator teres. And then posterior ones. Posteriorly there will be flexor digitorum profundus. And then what is medial? Medial, as you can see, it is ulnar nerve, simple. And it is also flexor carpi ulnaris. Means if it is flexor carpi ulnaris, will be here. So it will be medial, it will be lateral to the flexor carpi ulnaris muscle. And laterally there will be the tendons of flexor digitorum superficialis here. Okay, all these. Now if you come to the branches of the ulnar nerve, what are the branches? Branches are simple, all the muscular branches. Muscular branches are given to which muscles? It's easy. Flexor carpi ulnaris and flexor digitorum profundus, medial half of flexor digitorum profundus. It's simple. And then it gives collateral arteries, ulnar collateral arteries. Anterior and posterior, it's not collateral, sorry, it's recurrent arteries. Anterior and posterior ulnar recurrent arteries. What does they do is, they arise from here, and what does they do? They go above, and then anterior ulnar collateral artery, anterior ulnar recurrent artery anastomosis in front of the medial epicondyle, whereas posterior ulnar recurrent artery anastomosis behind the medial epicondyle, and they participate in elbow anastomosis. Okay, and it also gives, all these are branches, first it gives anterior and posterior ulnar carpal arteries. These forms anterior and posterior carpal arches. As there are palmar arches, there are carpal arches which are found here posteriorly on the carpal side, on the dorsal side. So even in that it participates. And then it also gives common interosseous arteries. These common interosseous arteries gives 3 branches: anterior interosseous artery, posterior interosseous artery, and interosseous recurrent artery. This interosseous recurrent artery goes above, ascends upwards, and then it anastomoses and it participates in the anastomosis of elbow joint. Okay, it forms anastomosis around the elbow joint. Okay, that is interosseous recurrent artery. And then the terminal branches are nothing but it continues as superficial palmar arch and gives a small deep branch in order to form deep palmar arch. This is ulnar artery. Now come to the anterior interosseous artery. Anterior interosseous artery, which is a branch of ulnar artery, it arises from the ulnar artery, and then it descends downwards, and then there will be pronator quadratus muscle here. In front of the pronator quadratus, it just pierces the interosseous membrane and then enters the posterior compartment. So whenever this interosseous membrane is pierced, whenever it pierces the interosseous membrane, it enters the posterior compartment. So thus again it enters the posterior compartment. The posterior compartment, it goes like this, and it anastomoses with posterior interosseous artery. Posterior interosseous artery total thing you will be learning in posterior compartment. And then this is ulnar artery. Now if you come to the radial artery, see the radial artery. Radial artery is a small terminal branch of the ulnar artery. It is of the brachial artery. It is smaller than the ulnar artery. It begins in the cubital fossa, that too at the level of neck of radius, and it passes downwards to the wrist with the lateral convexity, and then in the upper part it lies beneath the brachioradialis, and then it runs downwards and lies medial to the radial nerve. See, radial nerve lies like this, same like radial artery, ulnar nerve. Radial nerve lies medial, and then it comes like this, it runs downwards, and then it enters the palm by passing behind the flexor retinaculum, and then it gives 2 branches, deep branch and the superficial branch. Deep branch, it's very easy. This deep branch, this deep branch continues with deep palmar arch. The superficial branch is very small, so this superficial branch continues with superficial palmar arch. That is, it anastomoses with the ulnar artery and forms superficial palmar arch. So now this radial artery is given like this. And now if you come to the relations, anteriorly in the upper part it is overlapped by brachioradialis, and then in next of the part it is just by skin, superficial fascia and everything, and below posteriorly it is pronator teres and flexor digitorum superficialis. So now you can say this radial artery is the superficial artery. Radial artery is superficial artery. That means first when you remove the skin you can easily find the radial artery above. But in order to find the ulnar artery, you should remove all those superficial muscles, okay, to find the ulnar artery. So this is radial artery. Now the branches of radial artery is nothing but muscular branches it gives. It gives the muscular branches to all those muscles. And then what does it do is, it gives a branch called as radial recurrent branch. What does this radial recurrent branch do? This radial recurrent branch anastomoses with radial collateral artery or the branch from profunda brachii in the lateral epicondyle, around the lateral epicondyle, so that it participates in anastomosis around the elbow. It also gives a palmar carpal branch just like ulnar artery. And this palmar carpal branch, it just goes behind and then it forms palmar carpal arch, mainly carpal arch. And then it gives superficial palmar branch, superficial branch in order to form the superficial palmar arch, and it also gives a deep branch to form the deep palmar branch. All these are the two arteries which are the most important in the forearm, that is ulnar artery and the second is radial artery. And then what you will be learning now, it's easy guess. After arteries, what you will be learning now is the nerves. So what are the two nerves? Not two nerves, two arteries and three nerves. What are they? You know, it's medial nerve, ulnar nerve and radial nerve. Okay. So let me draw this thing. Just like arteries, I'll be explaining the nerves in the same diagram so that you'll be getting the relations clearly. Anatomy is nothing but relations. All the relations you will be learning if you imagine each and every thing clearly. Yeah. Now, let me draw first the brachial artery. At the neck of the radius, it divides into simple radial artery and then to ulnar artery. Right? Now, let's first learn the median nerve. Okay, just I'll be drawing each and every nerve so that you'll get it clearly. The median nerve has if you have learned the arm and cubital fossa, the median nerve is the principal nerve in front of the forearm. What does this median nerve do is, this median nerve is the medialmost content in the cubital fossa, and then it pierces the pronator teres. In between the two heads of pronator teres, it passes. Okay, it then crosses the ulnar artery. This is ulnar artery. It then crosses ulnar artery from medial to lateral. See, it has crossed ulnar artery from medial to lateral. Okay. Now it is separated from the ulnar artery by the deep head of pronator teres. That means if this is the median nerve, and then there will be deep head of pronator teres. This is deep head, and then there will be ulnar artery. If you see the cross section, it will be like this, and above there will be superficial head. So it passes between the two heads of pronator teres, superficial head and deep head. This deep head, what does it do? It separates the median nerve from the ulnar nerve. See. Okay, if I zoom here, if we take a cross section here, then you'll be seeing it like this. Okay. Now it has crossed the ulnar artery from medial to lateral side. Next, it passes beneath the flexor digitorum superficialis and in front of flexor digitorum profundus. That means if this is the nerve, it will be like this, between flexor digitorum superficialis and flexor digitorum profundus. FDS, FDP. It will be between flexor digitorum superficialis and flexor digitorum profundus here. Okay. And then it comes downwards. Same like that, it comes downwards. And then what does it do? It enters the wrist. Okay. And this is the relations and course of median nerve. Now branches. It's easy. It gives muscular branches. It supplies all the muscles which are present in the forearm, that means anterior compartment of forearm, except flexor carpi ulnaris and medial half of flexor digitorum profundus. Except them, it supplies the whole anterior compartment of forearm. And next, articular branches. It gives articular branches to elbow and proximal radio-ulnar joint. Even here it gives an articular branch. And then it also gives a branch, that is anterior interosseous nerve. This anterior interosseous nerve mainly supplies flexor pollicis longus, flexor digitorum profundus and pronator quadratus. So what is this difference is, this median nerve mainly supplies the superficial muscles. See, median nerve has such, it supplies superficial muscles. You know the superficial muscles, okay? So, but what is this? Medial nerve gives a branch that is called as anterior interosseous nerve. What does this nerve do? This supplies all the deep muscles. That's the just difference. The thing is, the whole muscles are supplied by median nerve indirectly. But directly, to say clearly, median nerve supplies has such superficial muscles, but the deep muscles are supplied by a branch of median nerve, which is anterior interosseous nerve. And then what does this nerve also give? It gives a branch to palmar cutaneous branch, and which you will be learning in wrist. Don't worry now. This is median nerve. Okay. Now you must have a little bit idea about it. So median nerve just pierces the pronator teres, and then it just crosses the ulnar artery. Then what does it do is it runs between flexor digitorum superficialis and flexor digitorum profundus. It is the course, and branches are easy. Now, which artery will learn? Ulnar artery. So which nerve will learn? Ulnar nerve. Ulnar nerve. It is the nerve which is present on the posterior compartment in the arm, and now it enters the anterior compartment. See now what does it do is, as you have learned in the arm, it is behind the medial epicondyle. See, it is now behind the medial epicondyle, and it enters the anterior compartment of arm by the gap between the two heads of flexor carpi ulnaris. It lies between flexor carpi ulnaris. It's easy. Ulnar nerve, flexor carpi ulnaris. Median nerve, it lies between pronator teres, two heads of pronator teres. Ulnar nerve lies between two heads of flexor carpi ulnaris. And then while it is running downwards, it runs between flexor carpi ulnaris and flexor digitorum profundus. Same as that. Flexor carpi ulnaris and flexor digitorum profundus. And in the middle there will be ulnar nerve. Both these two are medial nerves. Okay. So it is ulnar nerve. It lies between flexor carpi ulnaris and flexor digitorum profundus. Okay. And then it runs downwards and then passes lateral to the pisiform bone and enters into the wrist or arm, palm. It enters into the palm by passing deep to the flexor retinaculum. Okay, this is ulnar nerve. Branches. It gives muscular branches to flexor carpi ulnaris and medial half of flexor digitorum profundus, which are not supplied by median nerve. It also gives an articular branch to elbow joint and also a palmar cutaneous branch and dorsal cutaneous branch. All these are the branches of ulnar nerve. Now, let us learn about the final nerve, that is radial nerve. The radial nerve enters the cubital fossa between brachioradialis and brachialis muscle. Again, it gives two branches here. One is superficial and one is deep. Deep radial nerve, deep branch, it pierces the deep branch of radial nerve. It pierces the supinator muscle, or it runs between the two heads of supinator muscle, and then enters the posterior compartment of forearm, and then continues as posterior interosseous nerve. But here we are dealing with anterior compartment. So as a result, the superficial, see, it has entered the posterior compartment, this part. But now here we are dealing with the anterior compartment. So superficial branch of radial nerve, it is the main continuation of the radial nerve. It runs downwards and it covers the brachioradialis. It is covered by brachioradialis, and then it runs downwards and then it enters the wrist by passing behind the flexor retinaculum, and then it mainly gives it is ulnar nerve, na? Yeah, this ulnar nerve passes to the back of the wrist, that is, it enters the posterior compartment, and then it is seen in the posterior compartment mainly. And then it even, what does it do? It enters the anatomical snuff box, and from there it gives cutaneous supply to the, carpal aspect or dorsal aspect of the hand, dorsum of the hand. We shall be learning in the dorsum of hand. So this is the radial nerve in the, arm. So this is radial nerve, this is ulnar, this is medial. So you have learned all the nerves, all the arteries present in the front of the forearm. Now in the next class we will be learning the posterior compartment of forearm. Okay then, bye.